COVID and the government's response in other ways. Today we will address two areas of the COVID response. The first is looking at the increase in cases that we've had in recent times and the response, and also the topical issue around vaccines, which both the Chief Medical Officer and Dr. Ennis, who is responsible for immunization as head of family medicine, will comment on. So welcome again, members of the media, and to all those who are online and those in Jamaica and even outside of Jamaica. So in terms of the rise in COVID-19 cases and hospitalization, this, of course, is an issue for us. The Ministry of Health and Wellness continues, as is the case with the government of Jamaica, to be concerned with the rise in the number of confirmed COVID-19 cases in the country. Already this week, beginning Sunday last, the country added some 1,152 new cases to the overall count. That's within the space of, is it 4 days? 4 days or so, 4 or 5 days, which is unprecedented in terms of the number of positive cases that we have had since our first case on March 10th. Monday of this week saw some 403 cases, and yesterday, Wednesday, there were 329 cases. So the numbers continue to be high, and the positivity rate, more importantly, continue to be high, hovering around 15 to 20%, more on the 20% side over the last few days. As the new cases are confirmed, we have been seeing an increase in hospitalization. And there's a relationship between positives and hospitalization, and that is borne out in the data. Wednesday, for example, yesterday, Wednesday, saw our highest hospitalization with some 198 COVID-19 positive cases or patients in hospital, with a minimum so far this week of 159. Now, this is very, very important to note, because hospitalization means is an indication of the seriousness of the illness or the impact of COVID on those patients, and it also means an increased risk of the most severe outcome, of course, that would be death. And this is of concern to the ministry and to the government, as it should be to all Jamaicans. Currently, some 309 of the approximately 362 COVID-19 beds across the island are occupied, making the occupancy level for COVID-19 beds the highest it has been to date, at some 85.4%. So occupancy of our COVID wards, these are wards that we constructed in the early days of COVID, back in February, March and beyond, in each hospital across the country, with special features for separating them from the general populace, the provisions for additional oxygen or the ventilators, and again to protect both those who are in those wards and those who are within the institution, who are outside of those wards, because of the highly contagious nature of the virus. To the extent that we are overrun and have none of the additional capacity to deal with persons, is the extent to which we would enter into a new phase of the challenge, which would be a much more severe phase. So at 85.4% occupancy rate, this for us is a major warning signal. As a consequence, the measures announced by the Honorable Prime Minister in Parliament on Tuesday as part of the messaging to pull back and to get greater compliance and hopefully to cauterize the spread. I've asked the technical team to give us an analysis of hospitalization and across the island, because I think it's important for the populace to understand what the increased cases mean in terms of hospitalization. And our Chief Medical Officer, Dr. Jacqueline Bisesa Mackenzie will give this and the latest national epidemiological report and as I said, a hospital summary as part of just getting the public to appreciate where we are. So let me ask Dr. Bisesa Mackenzie now to come in.
Thank you, Minister, and good evening, everyone. Okay. So this is the situation, just to provide an update as of yesterday, the 10th. So we had 18,237 cases. We had 329 new cases that were confirmed yesterday, 254 by PCR testing, 75 from antigen testing. In terms of we have deaths, we would have had 363 deaths. Our case fatality rate is now at 2%, which is 13.3 deaths per 100,000 population, and 13 deaths per 100,000 population, excluding imported cases. If we look across the country, we can see where the cases are, and of course where it is that we're having high number of cases in which parishes. We would see that we have several parishes that are seeing higher numbers than we would have been seeing in the past when you would have seen this slide. So parishes from St. James, St. Elizabeth, Manchester, Clarendon, St. Catherine, Kingston, and St. Andrew. Those are parishes that are all having over 100 cases, some of them over 200 and some over 300 active cases. And active cases meaning that these cases would have been confirmed over the last 2 weeks. We're seeing a high number of active cases, 2,385 cases. Again, when we compare to probably 3-4 weeks ago, we would have been seeing less cases, sometimes a lot less than this in terms of our active cases, 700, 500, those numbers. Now we're way up at 2,385 cases. If we look at the rates, so the absolute numbers we saw in the slide before, this slide now looks at the rate, which is the number of cases per 100,000 population. And again, we can see the parishes that are heavily affected: Hanover, St. James, Trelawney, Manchester again, Kingston, and St. Andrew being having the highest rates per population. And of course, when we are seeing high rates in our parishes where we have a large number of the persons living, for example, Kingston and St. Andrew, St. Catherine, Clarendon, then you know that we are really having a serious problem now, and this is why it is that we would have effected an island-wide intervention rather than just targeting specific parishes. So again, we see here, you would see here written 5,280 active cases. Before we would have had 2,300, which are confirmed over the last 2 weeks. We do have some cases that would be released from their 14 days, but we still have to get in touch with them to actually release them from isolation, and so that is why we have a difference in the numbers. Next slide. This gives us what we call our epidemiological curve that gives us the trend. So we can see clearly here that we are still going up in terms of our numbers, and we can start to see a very steep rise in the numbers that would have occurred over the last couple of days. So this is looking at absolute number of cases, and certainly is going to be a reflection in terms of the number of tests that we are doing. In terms of the date, the 7-day moving average. So the 7-day moving average gives us a little better idea in terms of the trend, because it averages over the last 7 days what the numbers are. And so the dotted line would give you a better indication of our trend, but you can see that it is moving in tandem with the absolute numbers of cases. Here we look at the number of cases in each age group, and we can see that the number of cases are in fact rising in all the age groups. The first chart would be the 0 to 17 years, where we can see that the numbers are going up. Interestingly to note that the numbers are, in fact, that peak is actually higher than the peak that we had before in September. But certainly in keeping with what is happening in the rest of the country, when you look at the other age groups, the 18 to 39 years group, you will see that the numbers are going up as well as the 40 to 59, and of course the over 60. So all age groups, we are seeing an increase in numbers. And of course, the age group that we would expect that we are going to have more severely ill patients, more critically ill patients, and probably more poor outcomes, we are seeing the increase in the number of cases in that age group, which is the over 60 age group. This is very important for us to note, that if we see the numbers going up in this age group, then we can expect to have more hospitalizations, as the minister has said. If we look right across the country at the epidemiological curve for all the parishes, and these are the numbers of cases in each parish by time, you will see that to the end of the chart, all the parishes and numbers are going up. It is only Westmoreland where it is that we would have had they had started to see their rise from early on in November, December, and we would have addressed that with several interventions, and we would have seen those numbers coming down. We're starting to see a little bit up again. So the other parishes that we are starting to see that rise now, we would have implemented all those interventions in terms of our community activities, or increased awareness, or increased testing, so that we can detect the cases early, so that we can put in interventions to stop transmission. So right across the parish, the island, we see that this is happening now, hence the need for interventions right across the island. This is our positivity rate by week, and this gives us a better idea of trend, because even though the number of tests are going up, it is really the positivity rate that we look at to see the trend in terms of how our numbers are increasing rather. So we can see that over the last, probably before middle of January, towards the end of January, we were keeping below a 10% positivity rate. The last 2 weeks or so, we started to go up, and we would now have been going up into the teens. And so far for last week, we had a 16.2% positivity rate. And for this week so far, we have an 18.7% positivity rate. Again, we can see here that the numbers are going up. The blue line that you can see, or the dark line, looking almost black, is the number of deaths. And we would have seen that the numbers of deaths not as high as we had before, but certainly enough for us to be concerned. And we would have seen the number of moderate, severe, critically ill persons in the red line. So you would see a dropping off of that at the end of the curve, but remember that will change as time goes by, because persons have been in hospital for some time. And so therefore, even though our hospital numbers are going up, you may not actually see it reflected here, because this is by date of onset. So persons would be in hospital 2 weeks for 2 weeks or 10 days. Their date of onset would have been some days gone by. Here it is that we look at our community spread, and certainly we can see that right across the country, especially in the southern parishes, we would be seeing that a lot of pink there, meaning that a lot of communities are affected. And this is what, again, would have indicated that we needed to have an island-wide intervention. When we see several parishes within a community, several communities within a parish being affected, then it suggests that we need a parish-wide intervention. When we see several parishes in the island being affected, then it suggests that we need an island-wide intervention. These are the top 20 communities with active cases, and we can see again that Mandeville is an area that there is cause for concern. We have quite a few communities within Mandeville where we have the top 20 number of cases, and Clarendon, those parishes, Clarendon and Manchester, St. Catherine, those are the parishes where we're seeing a lot of communities, most of our communities that are being affected. In terms of hospitalizations, again, another thing that would have indicated to us that we needed to have more interventions, and it required now an island-wide activity or island-wide restrictions, would be what is happening in terms of our hospitalizations. Next slide. Okay, so here it is. Minister had indicated before, but here we can see by region the number of beds that are occupied. These would be our COVID beds, where we have had across the island a total of 362 beds that have just been reserved for COVID patients. Up until mid-January, I would say, we would be below 50% in terms of that occupancy rate. But now we have 309 out of 362 beds that are occupied, which represents an 85.4% positivity occupancy rate, which we have not had since the beginning of managing COVID-19. And just to look across the parishes in the Northeast region, we would see that the St. Anne's Bay Hospital would be the regional hospital where we would have the most numbers of persons in isolation, 30 persons in isolation with 21 confirmed cases. Next slide. In the Southeast region, where we have Kingston and St. Andrew and St. Catherine, our most heavily populated parishes, we can see that we have quite a number of persons, 139 persons in isolation across the hospitals, at the University Hospital of the West Indies, the Kingston Public Hospital, Spanish Town Hospital, and the National Chest Hospital, where we have the most beds being occupied. In the southern region is where we have been seeing the new increases in Manchester and Clarendon and St. Elizabeth, where we're seeing sharp increases in the number of cases. We would see that the Mandeville Regional Hospital, the Maypen Hospital, are the hospitals that will have the largest numbers of persons being isolated for COVID-19. In the Western region, Cornwall Regional Hospital is where the majority of the patients are. Again, the regional hospital that is being overwhelmed here, so we have to be very cautious here as well in St. James. So overall, this is what the trend has been since the 28th of January, that you would see that there is a definite increase in the number of beds being occupied island-wide. And for all the regions, you can see that this trend is going up. This is Sarah. Next, this is Nera. Next, Southern region and Western region. So the general trend for all the regions is that the bed occupancy is going up for persons in COVID isolation. Next slide. And this is in terms of the severity of illness. We can see that the general trend is that all categories of patients, the moderately ill patients in gray, the severely ill patients in orange, and the critically ill patients in blue. If you look from the 1st of February to the 13th, I don't think that is the correct day, but you can see that there is an increase in the number of all categories of illness. So indeed, this is a very serious situation that we're facing. one of our main aims in managing COVID and keeping our numbers down is that we keep the numbers down below the ability of our hospitals to manage. We do not want to overwhelm our facilities because, of course, it will affect the management not just of COVID patients, but of other patients as well. Thank you, Minister.
Thank you very much, CMO. So there you have it. The challenges are increasing cases, increasing positivity rates from 16 last week to approximately 18 plus this week, almost 19. Increase in all categories of age cohorts, including the vulnerable, the over 60s, and increase in hospitalization. And, you know, the next phase of that is normally increase in deaths. And that is something that we don't want to entertain at all. So we're still managing the numbers of persons who would, you know, of deaths, but it is almost a logical sequence that if you increase hospitalization and increase the severity, then the possibility of death becomes that much more real. And that is why the pullback is so important. And that is why all of us have to play our part in getting this process going. Thank you, CMO, for that. So I move on. We recognize, and the government that is led by the Honorable Prime Minister and other stakeholders that we have worked with, that we would come to a point when the possibility, not desirable, but the possibility of additional beds would be required. And we've spoken about this. And it does speak to forward thinking and planning by the team here that recommends these things to the government, who then actions them. And so we had always announced the plans to advance more beds. Initially, it was about the National Arena. Then we changed and we identified two locations, one at St. Joseph's Hospital, the other in Falmouth, in Western Jamaica, Falmouth Hospital. Now, luckily, 5 months ago, we broke ground for those two facilities. I want to commend the ministry, the permanent secretary in this case, working with the regions, and indeed the contractors who were deployed, and the project management team, because within that 5-month period, they were able to build out two facilities. I visited St. Joseph's today, and that facility is a real first-class facility. I mean, the media was there, so many persons would have seen. The Member of Parliament was there, and we're going to show the video. Are you going to show it now or later on? At the end. At the end, we'll show a video of it. But I was very impressed, and all accounts, including MP Julian Robinson, the councillor, the mayor, of course, our team, because we now have that 36-bed facility that would add to the bed count for COVID patients, equipped with all the necessary infrastructure for oxygen, ventilators, all the other stuff. Tomorrow I'm going into Falmouth to look at the other facility, which I understand is almost complete. So in a sense, in the nick of time, we can say that we have added, or will add in a few days, some 72 beds, two locations, one in Kingston, the other in Western Jamaica, as we had anticipated would be like a likely possibility. And these are now going to be equipped with the necessary infrastructure to deal with any overflow. As the CMO said, or I said earlier, we're at 85.4%. Now, at this rate, we will become overwhelmed and we will need that additional capacity. I want to say, so I want to say to the country, we are concerned, but we are not panicking. We need you to be responsible, because irresponsible behavior cannot be accommodated in its entirety if more cases keep popping up because of that kind of behavior. But we have made provisions and therefore are able to deal with additional capacity or requirement on the system. We've also done a couple of other things just to address the bed count. We are deploying another 21 beds at St. Joseph's Hospital. So 21 additional beds will be put into operation. And through the generosity, you may recall, of the US government, we had received a field hospital which was deployed at the National Chest Hospital. We're going to be relocating that to the Spanish Town Hospital because the Spanish Town Hospital is overwhelmed, and we think that's a more strategic location, and that's a 40-bed facility which is currently not being utilized. So a quick math here will say that we have 362 beds now at an 85% capacity. We're adding an additional, over the next few weeks, 133. So that would be the 72 from the 2 built-out permanent structures, the 21 additional at St. Joseph's, and the 40 from the field hospital donated by the U.S. government, which would give us now an additional 133 plus the 362. So we would ultimately have some 495 COVID beds, which would represent approximately a 35% or so increase. I really want to say thanks to all those who have helped to coordinate and gotten us to this point. And I want to say to the country, we are making provisions. Now, the facility is one thing. We have to equip the facilities, and the Pan American Health Organization is assisting us with some of the facilities that we need to equip the facilities. We have made provisions, or through the NHF, we have bought the beds and the other things that are necessary. The real challenge is with people, and we are making arrangements to deploy and to redeploy. We have some recently minted nurses who are going to be accredited or certified by the Nursing Council. We had some doctors that we had put brought in, 121 late last year. So there are arrangements that are being made, but it's still a very challenging period because there's also downtime from the existing personnel for one reason or another. So that is a challenge that we will have to continue to confront, but we are making provisions for additional capacity. Okay, so I'm going to turn now to an update on vaccines. And, there's a lot happening there. You would have seen and heard the presentation in Parliament that we are now in line to receiving our first quota from the COVAX facility, WHO COVAX facility. What about our preparation? The technical team continues its internal training and sensitization of the healthcare team that will administer the vaccines once the vaccines get here. Some 662 team members, a majority of whom are public health nurses, are now in training and will be ready to carry out vaccinations. So we have 4 regional health authorities. In the southern region, we have 170 persons in training, southern region being Clarendon, Manchester, St. Elizabeth. In the northeast region, which is Portland, St. Mary, and St. Anne, we have 120 persons in training. In western region, Trelawney, Westmoreland, St. James, and Hanover, we have 140 persons in training. And in the Southeast Regional Health Authority, the largest region, that's the corporate area, Kingston, St. Andrew, St. Catherine, and St. Thomas, we have 232 persons in training. Our number one priority, of course, it remains the safety of our people, and the government, through the ministry, will continue to seek out all avenues to the best health outcome for every citizen. So it's really about ensuring that we have the vaccines, and we're working very closely with the Ministry of Foreign Affairs and Foreign Trade. Minister Johnson Smith and I speak regularly with the Cabinet Subcommittee on Vaccines in terms of reaching out to source vaccines beyond the COVAX facility. And we are making progress, as well as with the private sector, where we will be signing or agreeing to an MOU to work with them, because they are also interested in playing a role, and we think we have to work together. But at the end of it all, our selection of a vaccine has to follow a protocol. And I want to reassure the public that we will not embrace or endorse any vaccines that falls out of the protocol of going through the expert assessment that the World Health Organization traditionally subjects a vaccine to before it is certified as safe. We are in touch. We have persons who are involved. Professor Figueroa, who was here last week with us. And that's the basis on which we will bring vaccines in. There are many offers out there, but we believe that it has worked in the past, this approach. And frankly speaking, we have our own experts here who will not breach that protocol. So the public can feel safe when we indeed embrace, endorse, and make available a vaccine to the population. And it is not long from now that we believe that a vaccine will be available to the populace. The World Health Organization has developed an interim guidance on the basis of the advice issued by the Strategic Advisory Group of Experts, SAGE for short, on immunization at its extraordinary meeting on February 8th, 2021. And those are the guidelines that we will follow. The Ministry of Health and Wellness, in administering the vaccines, will use these interim guidelines and the recommendations. And I want to now ask Dr. Melody Ennis, our Director of Family Health Services and our focal point for vaccines, to share with us a summary of the interim guidelines for vaccination as provided by the WHO. And this for us is important because we know the skepticisms, the suspicions, and the narrative, the anti-vax narrative that is out there. And we want to again reassure the public that we are doing the right thing. Dr. Ennis, you want to come in quickly?
Thank you so much, Minister, and good evening, everyone. It is indeed my pleasure this evening to share with you the interim guidelines that have been produced by PAHO WHO under the guidance of the Strategic Advisory Group. And first goal is that the AstraZeneca vaccine has been placed on the WHO's emergency use list, and therefore this vaccine can be administered to persons 18 years and above. 2 doses is what will be required. This will be given in the upper arm and it will be administered 8 weeks apart. So you'll get 1 dose and you'll get the second dose after about 8 weeks. Now, the concern for most persons is about older persons. The review has found that the immune response that is induced by this vaccine in older persons is excellent. The safety profile is good, and therefore the recommendation from this group is that the vaccine is safe and efficacious and should be used in persons over 65 years. We've also been concerned about comorbidities, and these diseases such as hypertension, diabetes, or cardiovascular illnesses, respiratory illnesses, and obesity were studied in the trials, and the results indicate that it is safe for the vaccine to be had by these persons, and therefore the recommendation is that these persons who we know fare the worst with the illness will be vaccinated with the AstraZeneca vaccine. Another group of interest to us, of course, are pregnant women. As you know, vaccines and other medications are not usually going to clinical trials on these persons. However, they have found that you have to weigh the risks and the benefits. It is known that persons who are pregnant and contract the COVID disease, they fare worse than their counterparts, and they tend to have premature deliveries. Bearing that in mind, and looking at the composition of the vaccine, we are now weighing the benefits of taking the vaccine with the risk of a detrimental, harmful pregnancy. And the recommendation is that for persons who are exposed, for persons with comorbid conditions, as I indicated before, then in these persons, the pregnant persons, the vaccine can be given. We have some other persons that we wonder about as well, and these are persons with HIV, persons who have autoimmune conditions, persons who are compromised, possibly from other disease conditions such as cancers. And the interim guidelines recognize that these persons might not mount the response to the full 100 as persons without these conditions, but the response that is mounted will still provide a source of safety for these persons. And as such, it is also recommended that they be given the vaccine. I believe we need to speak to the variants because that's what's topical now. So it has been found that the vaccine is slightly less effective for the UK variant of SARS-CoV-2. And it is reduced significantly for the South African variant, but that is for mild and moderate disease. It is believed that for severe disease, this vaccine that is presently on the table for inoculation will have some benefit in persons with severe disease. And countries have been advised that they should continue to vaccinate with the AstraZeneca vaccine as is. In addition to that, it should be noted that in most countries, including ours, the predominant variant is, of course, the original one. You know, we had recognized 4 or so cases from the UK with the UK variant, but we continue to sample to see when we have additional different variants, and we will take the appropriate steps at that time. So for now, in Jamaica, it's the original variant that is in circulation predominantly, and therefore the AstraZeneca vaccine is recommended for use at this time. I want to speak to allergic reactions and severe allergic reactions, including anaphylaxis, which is a life-threatening condition. Most persons are concerned because we have been hearing about this. Now, the studies that were done speaks to AstraZeneca now, and there has been no cases of anaphylaxis or such severe reactions with the AstraZeneca vaccine. But we all know that with any vaccine, persons can get an allergic reaction. And we want to assure the Jamaican public that when we are administering the vaccine, as we have always done with other vaccines, our precautions are at its best. We will observe patients for 15 to 30 minutes. We will have the requisite medications on hand should there be an allergic reaction. But at this time, we are confident and feel assured that the AstraZeneca vaccine may not allow us to get this kind of reaction. Minister, I believe, and CMO, I believe those are the major points coming out of the interim guidelines that have been provided by PAHO, WHO, and I do hope that they have served to allay some fears with our population. Over to you, Minister.
Thank you very much, Dr. Ennis, and thanks for the work you and your team have been doing. Very important information, and I think information that we will make available on critical in some reform so that the general public will be able to visit and digest so that they are fully aware of what is happening. In closing, I want to again underscore the importance, ladies and gentlemen, of what Dr. Ennis said, because we know that the narrative, the discussion, and in fairness, fueled by the global discussion, which we all have access to, has been the suspicions around the effectiveness, the efficacy of the AstraZeneca vaccine, which is the one that we have been promised through the COVAX facility, as well as through other windows we're exploring. The conclusion of the expert group, the World Health Organization, is as follows, as said by Dr. Ennis, and it's worth repeating. 1, the vaccine is safe to be used in persons 18 years and older. And perhaps most importantly, the clarity around for 60 years and older and persons with comorbidities. The conclusion by the experts is that the vaccine is safe for use. And so, in Dr. Figueroa did mention it last week as a member of that expert team. We are repeating that. That is the final conclusion, and that therefore gives us the basis, based on all the work that has been done, all the data that has been collected and analyzed. We are now speaking with confidence to the public of Jamaica in supporting the take-up of the vaccine, and this particular vaccine, the AstraZeneca vaccine, that the expert opinion is that the vaccine is safe in 18 years and older. It is safe in 60 years and older, the vulnerable groups, the older population, and we urge and encourage persons to take the vaccine, as they say, take the vax, because this is going to be a very effective way to dealing with the COVID threat that we face. She did say other things, but I just want to mention the fact that when the vaccine gets here, the priority, of course, will be frontline workers, health workers and others on the front line. And then we will gradually move into the infirmaries, the penal institutions, and then to the general populace, starting with the over 60s. And we want to urge persons to participate in that process. I want to make one final point before we look at a short clip of the new facility at St. Joseph's, which I visited today. I want to appeal to corporate Jamaica companies. We have been seeing an increased number of workplace clusters of COVID outbreak. The protocols are very clear as it relates to these outbreaks when we have these clusters. And by the way, for simplicity and explanation, it's really a cluster is an area within an entity, maybe a unit, a department, a floor, a team, a few workers who have developed or contracted COVID, and as a consequence places the entity at risk, or the wider group of individuals. The protocols are very clear. It's to extract those persons from the population, do some deep cleaning, do some contact tracing, do some testing, and as quickly as possible resume normality. We have had some within public health, Mandeville Hospital being perhaps the most prominent in the last few days. We have seen the release put out in terms of the Ministry of Culture and Entertainment, a small cluster there. But we have also seen a number of clusters in the private sector. And in Kingston and St. Andrew alone, there have been some 7 organizations with cluster of positive cases, I think, over the past week or thereabouts. It's not a cause to be alarmed or panic, but it demonstrates a need to remind us, ourselves, all of us, that we must ensure that our employees observe the protocols while at work. The wearing of the mask, the constant cleaning of surfaces, the observing of the protocols around physical distancing where that is possible. It's not always possible. The constant sanitizing, because we really want to discourage these clusters. It puts your office and your work in jeopardy. It slows you down. It increases inefficiencies. And of course, it brings pain and suffering to those who are affected. So I want to make that appeal to the population, and in particular to organizations, to manage their affairs internally and remind their staff around those protocols. Beyond that, ladies and gentlemen, it is to again remind us around this physical distancing, staying at home if you're not well, going to work while feeling ill. Maybe an act of commitment, bravery, if you will, in these times with COVID, particularly if you have symptoms that suggest COVID. Going to work while feeling ill is not smart. It's not wise. It's not good for the entity, because you could be spreading COVID and creating further mayhem. It's not good for you, because you need to recover, and isolation is key. And so we want to encourage that. Washing the hands, sanitizing, wearing masks, obeying the isolation orders, adhering to the Disaster Risk Management Act, all very critical as we move the process forward. I'm going to ask now for that short clip to be played, and then Stephen will share the questions that may come in. Today we are at St. Joseph's Hospital, where we are viewing the new COVID ward that was constructed over the last number of months to facilitate approximately 36 beds. This new facility comes equipped with temperature control, cubicle, sanitization stations, bathroom facilities, all the modern infrastructure that would require patients to get ventilation, oxygen support. And over the next couple of days, we are going now to be equipping the facility so that this can be operationalized next week. It will also include, of course, the staffing, which is now being worked on. In addition to that, we're adding another 21 beds next door in the St. Joseph's Hospital building, and we are equipping for use the US donated field hospital, which is approximately 40 beds. So basically, outside of the 400 or so beds that we have, we're adding an additional over 120 additional beds for COVID patients specifically. We are at the highest level of COVID ward occupancy that we have been since the start of COVID, almost 85%. So the new addition is timely. It will go a far way in providing support to people who need it. But the message has to be very clear that we want to discourage persons from using the facility. And that means observing the protocols. Ladies and gentlemen, it's so important that we wear the mask, exercise the distancing, sanitize, because we do not want persons to be hospitalized. When you're hospitalized, it means that you're very serious, and that's something we're trying to avoid. And I want to say that this. So, Stephen, over to you.
Thank you very much, Minister. Just remind our colleagues, our media colleagues on the Zoom, to use the raised hand feature to pose your questions. We're going to begin with Janet Silvera from the Gleaner.
Thank you. Good evening. I have 3 questions. The first is the Jamaica Hotel and Tourist Association is calling on the government to ensure that Jamaicans and foreign travelers who are coming into Jamaica are required to produce negative COVID-19 tests on arrival into the country. And also, I want to find out why we have not moved the requirement to 72 hours instead of 10 days, owing to the fact that people can now access COVID tests much easier than in the beginning. The next question: what company has been selected to lead the marketing campaign for the COVID vaccine? What were the factors that led that emergency contracting? And is the $400 million spend justified? And finally, how many new nurses and doctors in the government is the government looking to hire over the next 4 to 8 weeks? And the minister may have said that in his speech earlier, but I got cut off, so I did not hear. I couldn't hear at all. So my apologies if that was already said. How many persons do you expect to, nurses, you intend to hire over the next 4 to 8 weeks?
Okay, so I think the first question may be policy related. The issue of the 72 hours instead of 10 days, I'll ask the CMO to respond to. The issue of factors leading, what the name of the marketing company is, I probably have to have Stephen to answer that, because I don't know, to be honest with you. But we'll find it and give you the information. And how many new doctors and nurses, I'll ask the CMO. So the JTA's suggestion is worthy of consideration. We do now, as you know, have a requirement for testing for tourists coming in, and that, to our mind, was justified and is now being demonstrably shown, given that other countries are doing the same thing. When we started, there were some issues, but I think it has become normalized. For our locals, it's a policy decision, and it's not only up to me. I would certainly believe that the government, through the Prime Minister, the Cabinet, will consider. The Prime Minister is on record by speaking in the Parliament that some of the costs that the government has been accustomed to bearing or being responsible for is going to have to be reconsidered because of the impact and the cost associated with those responsibilities. I suspect that the concern raised by the JHTA is more a matter of the health threat and the need for the industry to bounce back, recognizing that persons coming and testing would reduce spread. I think that it's something that the Cabinet could consider. So I'll certainly raise it, and as I said, it's noted. CMO, you want to respond to the 72 versus 10 days?
Right. So let us recognize that a pretest does not guarantee that a person has not been exposed to COVID, and that person may not become positive at any point after, and that could be a day after, 3 days, 4 days, 5 days, of course, up to a 14-day period. So the requirement of the pretest would always give us better information the closer it is done to travel. And the main reason for the pretest is, of course, to stop persons who would have a positive test from traveling. So we certainly would advocate, you have indicated, and it is true that the test has become more available now, and so a shortening of the period, it could be considered at this time. But the benefit of the pretest is to stop persons from traveling if in fact they are positive. And the recognition that this is why we still need a quarantine period, because a person still can become positive up to 14 days after being exposed to the virus. So that certainly the time that we had utilized was really dependent on the availability of the test, and certainly can be reconsidered at this time. In terms of our staffing for the field hospitals, first of all, in terms of for St. Joseph's, you would have recognized that we had a functioning hospital before COVID, and that we had staff that was assigned to that hospital. So we will be bringing back some of those members of staff, the nurses, back to the facility in order to help to staff the area. We would have recognized that we had a set of graduates from our nursing schools in July, about 120, that some of them are still available for employment, as well as we would have had a batch that would have finished in October, where we have almost probably about 250 that would have completed and would have completed their regional examinations and would be ready for employment. So we will be looking at these groups of persons to see where we are in a position to employ more persons. I can't give you a number at this time to say how many persons would be employed. So we also have, in fact, before these persons had completed, we had, in fact, started negotiations with Cuba in terms of bringing in additional persons. So we had processed about 46 nurses who are in Ireland, and would have come in in December, would have completed a quarantine period, and are now ready for deployment. And some of these will help to alleviate the shortages and to staff the new COVID areas. At this time, we do not have plans to engage additional medical officers, but where there are vacancies, we certainly will try to fill those. And where there are shortages, we are looking at interim contracts in terms of getting persons on board to staff the areas. So over the next couple of days, we will be looking at more closely. We will start operating from those facilities, and we will have staff in place for those facilities.
Okay, thank you, CMO. Stephen, you want to tell us? I'm sorry to put you on the spot. The PS would normally address that.
That's fine. So the company that has been identified to do the marketing campaign is the One Integrated Group.
One Integrated.
Right.
Okay. So just to say on that, the marketing campaign and the budget, how it is determined, is really a function of the job that you want to, or the goals or objectives that you set yourself in a given period of time. I think the campaign is for a year, right? To the end of this year. So over this period of time, the issue is how do you assess the perceptions around vaccines or immunization? I think, in an unfortunate way, globally, or certainly in Jamaica, the anti-vax posture is probably stronger than it has ever been. And with the advent of the threat of COVID and the discussions around vaccines and the length of time for development and the side effects and so on, has created a real narrative that represents a real challenge for us. So I suspect that the strategy would be, how do you position vaccines and the take-up of the COVID vaccine in particular as an important response to dealing with COVID? And that really is around providing information. So it's about reaching the public, and this is a national campaign because we want as many persons as possible to take it up. So it's not just a narrow target group, there are subgroups within a larger group, and you have to assess what is required to get persons to overcome those objections, to provide understanding, but then also to persuade, take up, to influence action. So it's not about reach alone, it's also about impact. And the preliminary perception or the anecdotal, if not scientific, studies out there are suggesting way less support for vaccines than we would like as a country. In other words, we're seeing 30% in some instances when we're talking about a herd immunity that really ought to represent 70, 80%, especially for this type of novel virus that is sweeping the world and is impacting the entire population. So it's not an easy task, and my core discipline is marketing, so I can speak with authority. Sometimes we don't give sufficient value to the need to manage public perception. I will say, in support of my core discipline, that if perception runs counter to what you want persons to do, then no matter how real the reality is, you're likely not to get them to do it. It really starts with a belief, and we have to create that belief, and it has to be grounded in something. So I am not, I had a brainstorming session on Saturday with Stephen, who heads up the communications unit, and a number of persons, and I believe those guys were there too, the One Integrated. And I'm not going to be critical of the budget and what is required. I'm not envious of what they need to do, because it's a lot. And sometimes we get the impression that because you see a budget of 400 million, it means that these persons or entities are benefiting with that $400 million check. The vast majority of that money is likely to be in advertising spend, radio, TV, newspaper. Janet, you should know, being a media person, what it costs to take out a full page ad. Then there's underground activation in communities and deployment. Then there's the development of content, getting real people to participate or actors to participate. then there's, all sorts of things involved in that. So the firm may end up getting a small percentage of that. And I just make the point because I know that questions have been asked from time to time, and I think it's important that persons understand that the substance is as important as the style, whether we want to believe it or not. And in this instance, lives depend on it to make that point. And I think we're going to have to spend in order to get the return in the interest of the population. Thank you. Next question.
Thanks, Minister. We have a question here from Debbie Ann Wright. She's asking how many healthcare workers have so far tested positive for COVID-19, how many of the cases are active, and she's also asking, is there any update on efforts to have testing for COVID variants in the US?
Okay, so we would have tested 2,211 healthcare workers, and we would have had 513 positive persons. What? 513. Mm-hmm. What's the other question? US?
US? No, British or South Africa?
Huh?
Maybe she meant the British or South African variant, and I think we're on record of.
Okay, right. So we have been looking at alternative arrangements for testing in terms of the genomic sequencing. So we have not concretized those. We are still sending samples to CARFA. We did send off some samples this week, but we have started to explore the utilization of other labs in the US, and we have actually made contact with some and are working out some of the details.
Thanks, Simo. A third question from Debbie Ann Wright is, she's asking, the WHO has said that AstraZeneca vaccine doses could be administered up to 12 weeks apart to allow for vaccination of many persons as possible within a short time. Why has Jamaica decided on the lower 8 weeks timeline? Can I ask Dr. Ennis to respond to that?
Well, we have not made a final decision yet. So we do appreciate the new recommendation in terms of 8 to 12 weeks. So that certainly would allow us to vaccinate more persons, because it gives us the opportunity to have more confidence in the arrival of more vaccines. If we get one batch and we have started to vaccinate, then we would have at least 2 months to try to get more vaccines in place. So we do recognize the 8 to 12 weeks period, and how we will determine will be dependent on the surety of our supplies and the continuation and consistency of our supplies coming into country.
Thanks very much, Simo. We're going to go to Emma Lewis.
Hi, good evening, everyone. I have 2 questions. The first one is about the work clusters that have developed in, I think you mentioned, 7 work clusters in Kingston in the past week. And this brings me to a question I planned to ask anyway, about why have no work from home orders been issued? Wouldn't it make sense to ask employers to encourage their workers to stay home? And I'm particularly concerned about Kingston and St Andrew, where I'm not getting a feel for what your strategy is. We're hearing a lot about Manchester and other parishes, but we're not hearing much about what's happening in Kingston, St Andrew, and now I hear about all these clusters. So that's one. And the second one is When are you expecting us to receive the first vaccines? Since I know that at least 2 other Caribbean countries have received vaccines, and Barbados has already started vaccinating its population. So those were my 2 questions. Thank you.
So the work from home, thank you, Emma. The work from home order is a policy question. The government has encouraged and continues to encourage employers to explore and to do work from home where that is possible as part of the COVID response. We have mandated it, but we have certainly encouraged it. Again, the challenge is to strike the balance between ensuring that there is no major disruption to production and in the country, because clearly that has major impact on lives and livelihoods. And so, where it can work, we encourage it, but mandating it may actually create disruptions that are undesirable. And we've been at this for the last year, Emma, and it's, many entities, many companies are coping and are doing well. But there are a lot of companies out there, and to the extent that we think there's some room for improvement, we think we should highlight it, as I have done. But we don't think it is so bad that we should now mandate and restrict further working from office, particularly in cases where you may get more productivity in the judgment of the employers. So in other words, where it can work, we say sure, but let's not be so restrictive that it places some additional burden on the productive sector, because we need a productive sector to provide the employment that is required for economic activity. I think the next one was on vaccines and why we don't have when others have. Well, I think we have said, for the record, I don't know if CMO wants to come in, when we expect to get our vaccines under the COVAX facility. And this is from direct correspondence from the WHO, the coordinating agency. In the case of those jurisdictions that you've mentioned, they received, as I understand it, gifts from another country of some vaccines. We are exploring several avenues, including the possibility of donations. But remember, as I said, we are guided by a few things. One, we're guided by the WHO's validation and certification of the vaccines that we use, that we administer, that we encourage our people to take to ensure absolute safety. And secondly, we use a process to get to that point, including our own internal processes. So we may not be first out of the blocks, and I know it may appear that that is being slow or too slow, but we are certainly going to be cautious sufficient to ensure that when we take a decision or we announce a measure, it is grounded in the important safety and wellness features that any public health entity and government, responsible government, should represent. You want to add to that? Yes.
Just to answer with regards to the approaches that we are taking in our communities. So we have maintained a very consistent approach in terms of our case investigation and contact tracing. And this continues. So every time we have a positive case, we would start contact tracing. Once it is that we find that there are close contacts within households that are positive, then that would shift us to doing community interventions, where it is that we go out in the communities. Our community health aides would be out there on the roads, increasing awareness among persons, distributing flyers, speaking to persons. We bring our mobile units into those areas to do testing so that we can pick up if there is a spread outside of the household. And what we do is we increase awareness in the community that there is in fact persons with COVID-19, so everybody needs to take precautions. So right now you would find that in Kingston and St. Andrew, in Constant Spring, Franklin Town, and Barbican are areas that we are doing community activities at this time. Our community activities also include visits to the workplaces within the areas, visits to the churches. Sometimes we have to do spot checks on the churches when we find out that there are problems that are going on. When there is any indication of spread, persons that are not obeying the rules. So we are very active out there still in terms of these interventions. We have to be very consistent. We list our top 20 communities every day, and the parishes intervene in these communities to try to bring down the numbers by stopping transmission, because persons are more aware, obey the quarantine, maintain isolation, so that we can slow transmission in those areas. So those activities continue on a daily basis. All our parishes, as you can see, several communities across the parishes are affected. And sometimes it is a bit much for the health workers to get in all the communities at the same time. So we tend to target the ones that are more heavily affected, hence the top 20 listing. We have the maps that are sent out on a daily basis. Our epidemiology unit works very hard to ensure that on a daily basis, the mapping of the cases are sent out to each parish so that they know where it is that they are to intervene. So we urge the public that they must adhere to the measures, because despite the fact that we have COVID-19 in many, many communities, sometimes there are small amount of numbers within the communities, but that is the opportunity for the community to put in place interventions for everyone to be taking the precautions so you can stop it. You can stop the transmission right there, and then you will start to see the numbers going down. Because many times you may have one symptomatic person and you have several asymptomatic persons around that person. That means that you can stop that transmission if everybody adhere to the rules and wear their masks, physical distancing, washing their hands, hand sanitizing, and just making sure that if they are sick, they stay home. So we just want to encourage everybody that now is not the time for complacency. If we can maintain our measures and keep it going, we actually can see a light at the end of the tunnel with the vaccines coming. And so therefore, we have to just push ourselves. It is difficult. Interactions are things that we thrive on. It's the most natural thing that we can do to socialize and to interact with one another. We're putting in interventions that say no to that. It is unnatural, and we want to get past that. But we have to stay the course for a little while longer until we can get the vaccines in, so that we can have a more sustainable method than preventing interactions for stopping COVID-19.
Thank you very much, CMO. We're going to go to Damian Mitchell from the Gleaner.
Thank you very much, Stephen. Minister, this question is for you. How could you not know the company that received the vaccine and communications contract when the quantum of $422 million would mean that it would have to go to the cabinet for approval? That's my first question. I'll take that answer and then come back with the second.
Well, I don't know because I'm not involved in the process. That's a very genuine answer. And I don't know that it has gone to cabinet either. I know there's a budget for COVID expenditure, but as I understand it, this was an emergency procurement process that was administered internally within the ministry. And I am not a part of that process, totally frank. As I said, I had a brainstorming session with the team this past weekend, and I outlined what my own vision was and what I think they needed to do in terms of their focus. But I'm not sure why you would question whether or not I know or don't know if I said I don't know. I'm not operational, I'm policy. Anyway, go ahead. Next question, yes.
My next question is whether the government is considering removing the quarantine requirement for people who would have had 2 doses of the vaccine entering Jamaica.
Let me ask the CMO to respond to that.
Right. So we would have spoken at length about this in the last press conference, I think, because we would recognize that different vaccines have different periods over which immunity is developed. So we know, for example, that the Pfizer vaccine, they have said that after 7 days you start to acquire immunity. For the Moderna, they say after 14 days. The AstraZeneca, I think some of the literature is saying that it's a month before you start to have immunity. So there's a varying period during which persons, if they are exposed to the vaccine, to the virus, that they can still become infected. And that infection there would still be a 14-day incubation period. In addition to that, we have vaccines that are 90%, 95%, 70%, 60% efficient at stopping the virus. And that means that there's going to be 5%, 10%, more than that, of the population who receives the vaccine who still can become infected. 5% of 30 million people is a lot of people. So there is still a risk that is there for exposure leading to becoming infected and therefore the possibility of transmission. So the incubation period still has to be adhered to, hence the quarantine period. Now we are going to have to come to a time when we're going to have to now look at the vaccines that are there this time period and decide on a time that is going to be appropriate. But that also needs to be pinned onto when our population starts becoming vaccinated. Because vaccination protects the individual when it's a few persons that have been vaccinated. Quarantine protects the population. Vaccination starts protecting the population when a larger and larger number of persons have been vaccinated. So I know that persons are pressing for release of quarantine period, but we have to be cautious in the time period, and we just need a little bit more time to see the different vaccines that are being approved so that we can see what is a reasonable time to say that once you have completed your 2 doses and X amount of time has passed, that may be a month, it may be 6 weeks, that you don't need to be quarantined. But again, it's dependent on when our population starts to becoming vaccinated. So right now, we still have the quarantine in force.
Next question.
All right, thank you very much. I'm not sure if Janet has a follow-up. I see her hands raised still. All right. Gary Mitchell is asking if there's a similar observation in place for other highly contagious diseases, for example, chickenpox, in terms of our surveillance.
Oh, you mean if as a country captures the data on all of these contagious diseases? Yes, I would say yes, but the CMO can respond to that.
So we have a list of diseases that are highly infectious, and these are our class 1 notifiable diseases, and you can check the list on our webpage of those diseases that you are required, doctors, health professionals are required to report them on suspicion. So we do have a list. Our surveillance system is very, very mature within country. We have these class 1 notifications that persons are responsible, are required to report within 24 hours of suspicion.
All right, thanks very much, CMO. I think those are all the questions we have, Minister. So we'll hand back to you for your closing remarks.
Thank you very much, Stephen, and thanks to those who came on and asked questions. We appreciate the time, the effort, and hopefully the responses would help to facilitate a greater understanding of our response to COVID. Thanks to the CMO and Dr. Ennis also for their presentation. So in summary, ladies and gentlemen, tonight we want to highlight a couple of things. Firstly, the increased number of cases, the fact that our hospitalization numbers have gone up, and with that is a higher risk of severe illness and even deaths. And as a consequence, the justification for pulling back, which includes the stricter curfew hours announced by the Honorable Prime Minister in the Parliament on Tuesday. We are, however, making provisions to secure those who need hospital care by adding another 35% or so bed count, which is 133 additional beds, including the 2 new field hospital wings that have been built at St. Joseph's and Falmouth. And those are going to be operationalized in the coming days and weeks. And all the necessary equipment and staffing hopefully will be in place. We want to discourage usage, but it's there if persons need it. And then the next big idea or information from our perspective is the WHO's position on the vaccine that we will be getting under the COVAX arrangement, the AstraZeneca vaccine, which has now gotten the seal of approval, which the interim recommendation for use, that's what we call it, okay, interim recommendation for use of the vaccine. And as Dr. Ennis said earlier, 18 years and older, including the 60 plus with comorbidities, which hopefully will begin to alleviate some of the concerns and fears in the population. I want to thank you for listening, and we want to ask again to the country, to the Jamaican people, remember, it's all about us. We have to work together. We have to practice responsible behavior in wearing the mask, in the physical distancing, in observing the protocols in order to deal with the response to COVID. That's the most effective response. I understand there's a video. What's that? Oh, right. So the marketing budget, which came up a couple of times, I'm being told that the 400 plus million, 22 million is for the firm and 400 is for what? Placements, ads, that sort of thing. Okay, just for clarity to kind of separate the issues. I'm sure that 400 million can be broken out even further in terms of what goes to the Gleaner, the Observer, TVJ, RJR Group, and all the media houses that I know will do their best to promote the messaging around COVID. Thank you very much, and we will certainly keep in touch. Have a good night.
Reggae month is February. February is Reggae month. Come catch the rhythm virtually. We gone online totally on Reggae Month TV. Mega reggae concerts, interesting reggae documentaries, informative reggae symposia, and lots more. Online daily from 6 p.m. to 10 p.m. on PBCJ, Jam Vision, JCDC Facebook page, and several other cable and social media platforms. Details available on the Reggae Jamaica mobile app. Reggae Month TV. Tune in daily and be entertained and informed.
Healthcare workers are working very hard to ensure lives are saved and people recover quickly from COVID-19. But their work is becoming harder because you're not wearing your mask, washing your hands with soap and water, or using hand sanitizer, and you are not maintaining physical distance. Let's limit the need for hospital beds and ventilators. Do the right thing. Cover your nose and mouth with a mask. Practice good hand hygiene and maintain a physical distance of 6 feet between you and others. COVID-19 is not over. Protect yourself while protecting others. A message from the Ministry of Health and Wellness.
Do you have the Reggae Jamaica mobile app on your phone? No? Well, you could be missing out on news, views, interviews, events, and so much more